Good morning, authorities and teachers. My name is André Joseph Barrero Camposano, and today I'm going to talk about obsessive compulsive disorder. Introduction. Obsessive compulsive disorder, or OCD, is a mental health condition with three main characteristics. People with this disorder experience involuntary, irrational, and repetitive thoughts called obsessions. These obsessions generate anxiety and fear in the patient, who is compelled to perform compulsive actions that are compulsions in his attempt to neutralize the unpleasant sensations associated with the obsessions. Obsessions are thoughts or impulses that happen over and over and are out of our control. The person doesn't want to have those ideas. They are disturbing and unwanted, and usually the person knows that they doesn't make sense. Compulsions are repetitive actions or thoughts with which a person tries to neutralize, counteract, or remove obsessions. They can also include avoiding situations that evoke obsessions. They are time consuming and inhibit the performance of activities important to the person, such as socializing, working, going to school, and among others. Variese. Obsessive compulsive disorder is one of the five most common psychiatric diseases and is considered by the World Health Organization as one of the 20 most disabling diseases. It is a neurological problem that translates into an anxiety disorder characterized by obsessive thoughts. These obsessive ideas, moreover, are expressed in multiple ways and are experienced with feelings contrary to them, being able to cause compulsive behaviors in order to calm the anxiety they generate, and they are transformed into rituals or exaggerated reactions of resistance to the obsessive ideas themselves. Obsessive thoughts can be of different types. Impulses, which are characterized by being aggressive and causing an irrational fear of causing any type of harm to those closest to them. Ideas, which are manifested by an obsession with order, cleanliness, passing of time, among others. Obsessive thoughts, in turn, generate in the person suffering from them a defensive reaction that results in compulsions, that is, in repetitive acts whose purpose is to avoid the consequences of their own thoughts. Symptoms of obsessive compulsive disorder are translated into specific attitudes that are included in international clinical guidelines. Intolerance of uncertainty, threat over destination, perfectionism, excessive responsibility, belief about the importance of thoughts, the importance of controlling our own thoughts, and rigidity of ideas. Causes of obsessive compulsive disorder are not well understood, although different factors have been identified and may intervene in the development of this psychiatric illness. From a biological perspective, it has been found that people who suffer from it have alterations in the frontal lobe of the brain and in the secretion of serotonin. It is also known that there are genetic factors that determine the development of obsessive compulsive disorder, although the way in which they are transmitted is unknown. However, it must also be taken into account that there are specific events or situations in a person's life that can act as triggers. They can be their own illnesses or that of a family member, the death of a loved one, a separation, a divorce, a very high education, trauma from childhood, and among others. Diagnosis. Steps to help diagnose the obsessive compulsive disorder may include psychological evaluation, diagnostic criteria for obsessive compulsive disorder, and a physical exam. Treatment. Obsessive compulsive disorder treatment may not result in a cure, but it can help control symptoms so they don't dominate us in our daily life. Depending on the severity of the obsessive compulsive disorder, some people may need long-term, continuous, or more intensive treatment. The two main treatments for obsessive compulsive disorder are psychotherapy and medications. Conclusion. Obsessive compulsive disorder is a mental condition that involves presenting thoughts, there are obsessions, and rituals, compulsions, over and over again. This interfere with your life but you cannot control or stop them. The cause of obsessive compulsive disorder is not known. Factors such as genetics, brain biology, and chemistry, along with your environment, can play a role in the condition. In general, obsessive compulsive disorder begins in adolescence or as a young adult. Boys often develop OCD at an earlier age than girls. Obsessions are repeating thoughts, impulses, or mental images that cause anxiety. Compulsions are behaviors that you feel you have to do over and over again to try to reduce the anxiety or stop the obsessive thoughts. The main treatments for excessive compulsive disorder are cognitive behavioral therapy, medications, or both. Thank you so much for your attention.